So I'm here with Dr. Alan Freestone, and we're talking a little bit about COVID-19 and all the tests and things. So how's all this impacting your practice?
Well, we see lots of people this time of year with many illnesses, including the worried well. We all have a lot of respiratory stuff at this time of year that may be different than COVID-19. However, since this is a hot topic and going around, we're seeing a lot of it. We're seeing people who have a lot of concern for it. So it does slow down practice and stuff a little bit, providing regular routine care because not everybody needs to be tested. In my opinion, and good medical opinions are that you perform testing if it's going to change management. Many of us, 85% or more, may get this infection. Most of us are going to, you'll have an illness and you'll get over it and maybe uncomfortable for a little while. A smaller minority, they're going to be sick and hospitalized and, may even die from this illness, those who have underlying conditions or they're older. So a lot of us, we may want testing, but it's not going to change what we do. If you feel like you are infected and are having symptoms and don't need to be hospitalized, then the better part of valor is just to self-quarantine and not expose yourself to anybody else. Because getting to do testing is utilizing a lot of personal protective equipment that we have a shortage on. So to get testing is depleting those supplies. The limitation right now isn't testing, it's the other things that providers need to protect themselves so they don't get infected. Because if the providers get infected and can't be exposed to other people, it's going to really hurt the healthcare community. For example, I've already been approached. I'm not an intensive practice medicine. I'm not an ICU doctor. I'm not a specialist in that realm. However, if it comes down to it and they need more people on the front lines in the hospital and stuff, I've already been contacted, and all the hospitals in our area and our community are doing the same thing. They're planning for potential types of things, making sure that my phone number and things are available so we can go and help where needed, because there's a lot of directing traffic and doing other kind of things, taking care of other kinds of stuff while the intensivists and other folks are taking care of the really sick people. So it's a big issue in our community right now. However, we all don't need to be tested.
Right. Well, I know my daughter, Michelle, she's by the way, she's now officially the base pharmacist.
There we go.
And so she's saying the same thing. The clinics are having, and this is over in Germany, and she's having some serious issues with, people coming in. They do testing outside and the whole bit.
Yeah.
So how do you, how are the supplies impacting the ability for you guys to do your daily jobs?
Well, even our daily jobs in the office, if there are things that we need to do to protect ourselves and the patient, from, infectious droplet kind of things. Most things we do in our office are not droplet. They're just, keeping things off of us. But even the typical gowns and things, we try to order them from the big suppliers. However, we aren't first in line for those products, as we shouldn't be. But there's just a shortage everywhere, so it may slow some of those things down. For example, you look at all the community hospitals around in the whole state, all elective surgeries are put on hold. That gallbladder is going to get taken out, or my sinus is going to get fixed or put on hold because it's taking a potential space where if there's any complications, you take up a bed for someone who's much more severely ill. And so it's definitely affecting medical practices and depleting needed supplies.
Well, that's the one thing that I was wondering, though, is to get a little clarification. What, in your mind, because what's the difference between an elective surgery and, where does it change from an elective surgery to, okay, you're getting this done now?
Well, many things, like from the orthopedic realm, if you have a severe ankle fracture that's unstable, you can't stand on it, and that needs to be fixed. I saw a surgeon at the hospital yesterday. The person had a hernia that could not be reduced in the emergency room, meaning put back. It was sticking out of the hernia sac, so then could therefore become incarcerated and strangulated. So people need surgery to fix those things now. I've got a hernia in my belly button, but it hasn't changed for 5 years. I don't need surgery on it now. I eventually might need surgery. It doesn't cause me any pain. It's just more unsightly, but it doesn't require surgery right now. I could go get it fixed, but purely elective right now.
Okay. Is colonoscopy considered elective?
Yes. Colon cancer is not elective. You want to take those things, don't want those sitting around, but colonoscopies are often elective. I've not spoken to our GI colleagues recently about what they're doing, but it's not a surgery. it's a procedure that's done that doesn't take a lot of the. Sure, they wear a gown, other kind of stuff, but they're not. All the face requirements and all those things are different because they're not really exchanging fluids and those types of things that are spread. Colon cancer is not spread through the air.
Yeah.
Yeah.
No.
Yeah. So, yeah, I don't know what our GI colleagues are doing, but I had to give them a call actually.
Okay.
For example, I contacted my physical therapy colleagues today because the patient needed to be seen by them to have her condition improve. However, I called to make sure that they were still operating like we are in the clinic, and they are. So, but not everybody is.
Interesting. What's the question you get asked the most with all this stuff going on?
Well, should I really come in so I don't want to be exposed? Is the biggest question. And should I get tested?
And the answers are?
I reassure people, letting them know, people that are elderly